Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Clubbing. Clubbing is actually a selective bulbous enlargement which is seen on the distal portion of the digit is clubbing. So here there is only selective bulbous enlargement is seen, and that enlargement is also seen in the distal portion. Whenever there is enlargement of distal portion, this is called as clubbing. In clubbing, the subungual, that is the below the nail, the soft tissue which is present below the nail is increased in size in clubbing. So in clubbing, we should measure the angle between the nail and the nail bed. So always in clubbing, we should see the angle which is present between the nail and the nail bed. The angle between the nail and the nail bed should be seen. Okay, this angle between the nail and the nail bed should be measured in clubbing. So in clubbing, if the angle between the nail and nail bed is 160 degrees, actually normal angle between the nail and nail bed is 160 degrees. But if this angle is called as Levy bond angle, that is the angle between the nail and the nail bed, this angle is called as Levy bond angle. Minimum duration which is required for clubbing is almost in 2 to 3 weeks itself clubbing can develop. Clubbing first appears in index finger. So clubbing first appears in index finger. It can occur in a duration of 2 to 3 weeks. The angle between the nail and the nail bed is called as Levy bond angle, and that is around 160 degrees.
thank you and thank you for watching.